For novel pathogens such as novel coronavirus, MERS-CoV, or avian flu, the recommended additional precautions are airborne, droplet, and contact precautions. These require you to wear the following PPE, or personal protective equipment: gown, fit-tested, seal-checked N95 respirator, face shield, and gloves. When donning PPE, perform hand hygiene for 20 seconds. Apply 1 to 2 pumps of alcohol-based hand rub to palms of dry hands. Rub hands together, rubbing palm to palm, in between and around the fingers, on the back of hands as well as the fingertips and nail beds. Continue rubbing until hands are dry. Hand hygiene using alcohol-based rub is the preferred method. Use soap and water only when hands are visibly soiled. Tie back long hair. Do not bring any unnecessary equipment into your room. Inspect your equipment for any damage prior to donning each piece. Don your gown. Tie around the neck and around your waist. Secure the gown using a bow that can be easily untied. Ensure that all clothing is covered by the gown. Lift your chin and place the fit-tested N95 respirator over your nose and mouth. Stretch the bottom strap over your head and place it on the back of your neck. Ensure strap is on bare skin only. Place the top strap on the crown of your head. Ensure that the straps are not overlapping or crossed. Check if mask is properly formed to face. Ensure no fold by running fingers along the edges of the mask. Mold the metal nose strip to conform to the shape of your nose. Do this by placing your middle fingers at the bridge of your nose and use your index finger to press along the edge of the mask, along the sides of your nose, onto cheeks, creating a good seal. Repeat pressing index fingers, especially alongside the nose. Perform a seal check by placing your hand at the side of your face at eyebrow level without touching the mask. Exhale quickly once to check if air escapes the mask and hits the palms of your hands. If you feel leakage, readjust the fit of your N95 respirator and perform another seal check. Don your face shield by placing the strap at the back of your head. Ensure that the top of the face shield is resting in the middle of your forehead. Put on your gloves. Ensure that gloves are placed over the cuff of the gown so that the skin of your wrist is not exposed. Perform a final personal preventive equipment check prior to going into the room. Have a colleague perform the final check. After entering the patient's room, keep your hands away from face. The docking process possesses the highest risk of transmission to healthcare workers. Make sure to take your time removing the personal protective equipment. Remove the gloves using the glove-to-glove and skin-to-skin technique and place in the garbage. You may perform hand hygiene at this time. Next, untie your gown around the waist and neck. Grab the straps from the back of the neck and slowly pull the gown forward and peel it away from you, touching only the inside of the gown. Be careful not to let the gown touch your clothes. Roll the gown into a ball and place in the garbage. Perform hand hygiene for 20 seconds. Remove the face shield by grabbing the back of your head, bend forward, eyes forward, chin out. Dispose of the face shield into the garbage. Remove one strap at a time, starting with the bottom strap first and removing the top strap last. Remove the straps by grasping them from the back of your head. Dispose the N95 respirator in the garbage, or if indicated due to a shortage of N95s, Place in a Ziploc bag with your name on it. Perform hand hygiene for 20 seconds. Rooms with anti-rooms are the preferred accommodations for patients under airborne and droplet and contact precautions. If there is no anti-room, remove all PPE inside the patient's room at the doorway, with the exception of the N95 respirator, which must be removed in the hallway.